Hi, my name's Cassandra Wylie, and I will be talking about my reflective practice activity for the principles and practice of difficult venous access.
Okay, so I'm just going to set the scene. I was working in a very busy medical oncology ward for a morning shift. I was allocated a COVID positive patient who was in isolation, who I identified would be quite a difficult potential cannulation. IV cannulation was indicated for multiple reasons, mainly because she was having IV antibiotics and she was requiring blood products.
Using the 3M peripheral vein assessment tool, my patient would probably be a grade 4 with poor to none identifiable veins. The nursing staff had previously escalated this patient probably required a CVAD, but due to the patient's coagulation status and infection risk, the team were hesitant to order a PIC. She had multiple old bruising sites from previous venipunctures and failed cannulation attempts. She also had quite a lot of peripheral edema, which made it quite hard to palpate any veins.
So I identified this patient was going to be a likely difficult cannulation. I sourced the machine to complete a vein assessment. I obtained the patient's consent and they were happy to proceed. I discussed that we were going to use the ultrasound to target a vein instead of going in blind. The patient was COVID positive, which added some complexity as I had to wear full PPE and I had to ensure I had all my supplies with me. The patient was happy to proceed and I started my assessment.
So I brought the machine in, I started to set up. I made sure the patient was comfortable, her head was a little bit elevated, her arm was propped in an accessible way so I could reach it to use the ultrasound probe. I placed the ultrasound machine in front of the bed sort of so I could see it in my line of sight so I wasn't straining. I elevated the bed so I wasn't bending down or leaning in a weird position just to make sure I had ease of access and that I was comfortable.
Then I applied the gel to the patient's arm and basically scanned them from top to bottom to find the appropriate vessels and the anatomy I needed to stay away from. The patient did have limited options. I found maybe two potential vessels, one on each arm. They were quite small and they were deeper veins, not palpable.
Once I assessed the veins, I set up my sterile field and I decided to try and cannulate this vein I found on the right forearm. I set everything up. I tried to cannulate. I had initially identified the needle on the screen, but when I was trying to advance, I just kept having difficulty finding where the needle was, and I ended up abandoning that attempt. When I think about it now, I think I was inserting from the completely wrong angle and it was just not in the right field of sight. So I wasn't able to successfully cannulate that vessel. So I did abandon that attempt. The patient was happy for me to have a second go. She was very understanding. She had multiple doctors, even anesthetics, coming in doing multiple attempts. So she was happy for me to try again. I set up my sterile field again and I decided to go for this vein on the other arm on the left upper forearm. It was quite a small vessel, so I decided to use a 22 gauge cannula. I initially had good blood return and it flushed really well. There was no pain, any problems. So I managed to get that cannula in okay. Overall, this experience was quite challenging. Being in full PPE amongst my existing workload, I had three other patients that I was looking after as well. And, performing an unfamiliar new skill, it was a bit daunting. During the task, I was just trying to keep calm and level headed, remember what I'd learnt during the workshops and activities. I did feel overwhelmed, particularly that I didn't have like a support person available to guide me through the process. I wonder if that would have maybe helped my success if I had someone to kind of bounce ideas off of, and maybe might have made me feel a bit more comfortable. But just considering the experience in hindsight, it made me feel more motivated to attempt further ultrasound cannulations and to further improve my skill. I think in reflection, probably next time it's probably a good idea that I have a more supportive environment, probably not in isolation, and I try and make sure it's a bit more, I guess, accessible to learning, and maybe I have a colleague or someone there to assist me during the procedure. In evaluating myself and my performance of this skill, I think the hardest thing, the thing I had most trouble with was my dexterity, being able to hold the probe with my non-dominant hand and then insert the needle with my dominant hand. I just felt quite clunky and like very awkward. I found that was the most challenging part of the procedure for me. Um, I kind of struggled to make sure I was going in on the right angle, like making sure I was holding the probe and getting the picture correct while also inserting at the right angle. I found quite challenging. I think that's also because I'm used to inserting cannulas at very tiny angles with my patients who have very, very tiny veins for chemotherapies and things. So I think that probably affected my experiences at inserting um, cannulas at certain angles. It's something I'm going to have to practice and just be more mindful that, you know, with ultrasound guided cannulations, I have to approach the higher angle that I'm used to. In thinking about what I did well, I think I was able to identify the anatomy from each other quite well and distinguish, you know, the different parts, the veins, the arteries, the muscles, the nerves. I'm quite surprised that I was able to kind of say, oh, that looks like an artery, it's pulsating, that's a vein, it's winking at me, that kind of thing. I was able to kind of, you know, determine them from each other and isolate them. That was something that I was quite happy with, that I was able to, you know, look at the image and determine, you know, what I needed to find, and that it was what I needed to avoid. So I was quite happy with that. In thinking about what maybe didn't go so well, I think the setup was something that wasn't so great. I had to doff my PPE, grab more supplies, don it all on again, and go back into the room. So that wasted time and was quite frustrating. I think in future experiences, I'll just have to remember that to make sure I've got enough supplies to avoid disruptions of the skill and that will make it run smoother with less interruption. In analyzing my skill and my experience, I've just written a few things here that I need to think about and remember for my future attempts, and things I want to try and consolidate before I try again.
I did have two attempts for this experience, probably related towards my inexperience and developing a new skill. This requires reflection and application to my future practice. How can I improve next time? Improving my preparedness, having all my supplies ready, maybe having a support person next time to guide and assist to improve outcomes. And maybe next time just watching some more ultrasound guided insertions in clinical experience and online, just to improve my understanding and technique.
What do I need to improve on this skill? I think the main one is the physical dexterity and coordination of holding both the probe and the needle. I think confidence in identifying the needle on the screen and accurately following it. I think patient advocacy is a big one, and just building on my knowledge and being able to advocate for my patients and their needs with vascular access devices. And I think the main thing is exposure to the skill and ensuring that I have the time and resources to practice and improve on it. My action plan for next time will include maybe considering a patient who might be easier than this one, particularly just the environment, having support around to facilitate the skill in a supported environment, ensuring all equipment is available, and that I feel ready to apply the knowledge that I've reflected upon on my next ultrasound guided cannulation. Also, just discussing with my colleagues on how we can improve our successes, particularly because we are all learning this new skill and are novices. So that's something that's we've got to think about. Next time, I want to practice watching a lot more insertions and familiarizing myself with the skill. I think I learn quite well by watching instructional videos and committing it to my brain. So I think that's something I'll try and work on just to cement it into my mind. I'll consider practicing on more educational equipment just to consolidate that skill into muscle memory.